I want to thank Governor Pritzker and Dr. Weiner for holding this press conference today to announce the launch of Beacon, the Behavioral Healthcare and Ongoing Navigation Portal, which is, as we know, a centralized website where families can access information about behavioral health services and receive help navigating the process of arranging those services for young people. In the last couple of years, Dr. Weiner and the Illinois Children's Mental Health Partnership have been close allies, in particular helping me to roll out the Illinois Student Mental Health Council, which was a product of legislation that I passed in the previous General Assembly. That council was the result of a law that I had passed that was directly inspired by teenagers in the 7th District, which I represent. We have a People's Legislative Council which sits down constituents by groups, and the young people in my district and all of their councils consistently raised access to mental health is the #1 issue that they face. Not just in terms of how to find mental health, but the stigma around mental health. And so many of our young people are so overworked and overstimulated that oftentimes what they told us is they don't even know where to start. And so having a portal like this is such an important systemic step forward in helping those young people and their families access the help that they've been telling us that they need for a long time. The law that I passed also ensures that the curricula for elementary and secondary schools would be required to include how and where our young people access mental health. So the Beacon portal will obviously be a part of that lesson. Those lesson plans that'll be offered in our schools as a result of that law. And so the rollout of the Beacon portal is an encouraging next step in providing resources not just to students but to all families all across Illinois, because as Summer's story makes clear to all of us, you know, we all probably know somebody that is struggling with mental health, young people in our families, parents in our families, grandparents in our families that are often isolated and don't know where to start as well. And so, you know, this is really going to be not just helpful to those young people, but to entire communities that are plagued by just the lack of access to mental health and healing that, frankly, is the root of so much of the violence that we see all across our country. I've spoken with countless young people and their families, as well as visited every healthcare provider in the 7th District that I represent. And what I can tell you is that even beyond the schools that we visited, even in the healthcare provider settings, even the providers raise this issue. Whether it's, you know, knowing that the resources exist at a hospital or a clinic, but the people that need it just a few blocks down have no clue where to go to actually access those resources, can be very frustrating and demoralizing to mental health workers that believe in this work but see that systemic gap and often feel helpless to do anything to address it. And so we also know that, you know, just a couple of years ago, I had the honor of sitting on a panel with the U.S. Surgeon General where we looked at the Youth Mental Health Council that we have in Illinois, but we talked about things such as social media and all the other unprecedented forces that are acting on our young people today, that even, you know, a guy like me that's not that much older than our young people, look, 20 years ago, my generation wasn't dealing with this stuff. I mean, we didn't have, you know, just unlimited stimulation and notifications and, you know, images on social media that make us feel, you know, depressed and anxious about ourselves and where we're from. And so our young people today are just soldiers, literally, and going forward and trying to be healthy as well as their families. And on that panel, you know, even the Surgeon General told us that, you know, our young people right now are encountering challenges that no generation before them has ever had to deal with. So that, you know, makes it even more important that we have a portal like this that, as the governor said, will be easy to access. It's one website where you go in and you get that case management, you get that linkage to resources, you get just an easy way of probably tackling a number of different things that you or your family might be going through. And so what I also wanted to point out is that you know, right now, as this resource rolls out, legislators are going to have a lot more work to do in terms of, you know, dealing with the other issues around mental health parity. So there we have a resource that's available like Beacon Portal. What happens, as a previous speaker said, when there aren't enough mental health workers to meet the needs of our young people, because the great thing about a resource like this is it actually creates that pathway. But we've got to make sure that we do what we can, and I look forward to working with Lindsay LaPointe, who's been a great champion in this area of really increasing the workforce of those that work in mental health, making sure that we pay them living wages, because they are some of the most underpaid people in our state right now. And everybody in here understands that this is about the most important public policy issue that we can get our hands around, and that is the mental health of our young people, because they're going to be leading our state in a pretty soon time here. And so that is work that is worth fighting for. I want to also just quickly mention that I'm personally happy as a senator for the 7th District that I've looked, and Beacon is currently available in 7 languages that can be found on beacon.illinois.gov. My team and I have navigated the Beacon portal firsthand and can share that it is a straightforward portal that takes only a few minutes to create an account and a profile. So I really want my constituents to hear that this really is an easier way to access the mental health resources you need. And as a senator who represents a district where nearly 100 languages and dialects are spoken, I am personally grateful for the language access that Beacon offers. That said, I want to point out that I am half Ethiopian American, and in Ethiopia we speak Amharic, we speak Tigrinya, Oromo, and a number of other languages. So I want to make sure that the Beacon portal includes a number of languages from Africa, because if you're in my district, you've got about easily 50 different African languages that are spoken, and those communities want to be included in this too. So looking forward to pushing forward on that. And finally, I just want to say that thank you again to the governor, thank you to Dr. Rayner, and to all of our child and family serving agencies for making sure that every family and child has easy access to mental health support and the resources that they need.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, please follow them on social media using the links in the description down below.